impact of COVID-19 pandemic on physical and mental well-being of people with Parkinson's. So before we start off with discussing about, what is related, what COVID-19 can do to people. So we want to know what exactly is COVID-19. But I think most of you know a little bit or two about COVID-19. It is a short term defined by World Health Organization. So the full name is actually coronavirus disease. So COVID is the coronavirus. D stands for the disease, which happened or which started in 2019. So the culprit here is actually a virus called SARS-CoV-2. So what SARS-CoV-2 defines is severe acute respiratory syndrome, which is caused by the virus which is in corona shape or something shaped like a crown. So that is why we call as SARS-CoV-2. We actually have a lot of coronavirus, but a lot of them do not cause this acute respiratory syndrome. So we have only about 3 in the world that causes the acute respiratory problem. I'll talk about that into much details in the next slide, but just to briefly introduce you. So the culprit is SARS-CoV-2, which causes the coronavirus infection. So the outbreak actually started first in Wuhan, China. So Wuhan is actually the largest city in Hubei province, and it is one of the most populous city in central China. So it started off in Wuhan in December 2019. And the thing is that the China cases have stopped dramatically. And in fact, until today, Malaysian total cases are much more than China total cases to date. So as I said earlier, we have different types of SARS-related coronavirus. There are 3 main types of it actually. We have SARS-CoV, the one in yellow, SARS-CoV-2, which we are facing at the moment, and we have Muscovy infections as well. Muscovy infection is very much famous for people who are doing pilgrimage, especially during the Mecca time. People are very concerned about Muscovy infection. So Muscovy actually stands for Middle East Respiratory Syndrome, hence the name MERS. And SARS basically is severe acute respiratory syndrome, which is almost similar as the coronavirus. Okay, so the outbreak actually started off in 2003 for SARS-CoV. And MERS-CoV actually started in 2012. And the latest one that we are experiencing or facing at the moment is SARS-CoV-2, which started off, as I said earlier, in 2019. So if you can actually see the diagram here, until this year, we still have MERS-CoV infection, although the number is not as high as COVID-19. But until now, to date, until January of this year, we have about more than 2,500 people being infected, and there's about 866 deaths related to MERS-CoV. So the fatality rate or the mortality rate for MERS-CoV is actually very, very, very high, which is about 35%. So it's almost to say that about 3 or 4 people who experience MERS-CoV infection will actually perish because of this. As far as SARS-CoV, the first SARS-CoV is concerned, the infected people are about 8,422. We don't have any more cases as for to date, fortunately, but the death was about 774, which brings the fatality or the mortality rate of about 11%. So it is much smaller than MERS-CoV. But for the one that we are facing at the moment, SARS-CoV-2, and why it is called as pandemic is because it has infected more than 230 million people worldwide. So it's million times more compared to SARS-CoV and SARS-CoV-2. Why? Because the infectivity rate is very, very, very high. So that's why everybody is very concerned about getting infected with COVID-19. And the death, as per September, about a couple of days back, when I checked the website, it's about more than 4.7 million deaths worldwide. In our country, we have about we have more than 2 million infected cases at this particular moment, and we have about 20,000 plus cases of death. So the infectivity rate, the mortality rate for SARS-CoV-2 is actually much lower. So people who die because of COVID-19 is actually about 2% only. But the infection spreads very, very quickly. So this is the reason why people are taking very extra precautions, especially to prevent the transmission of COVID-19. So if you look at the Malaysian COVID-19 statistic, as of September, we have, as I said earlier, we have more than 2 million cases of confirmed COVID-19. So that means it could be more for the undetected cases, but as for the ones which are registered by Ministry of Health, there are about 2 million, more than 2 million, with 24,000 deaths. But fortunately, because our country is playing, very much good role in encouraging people to be vaccinated. So we have up until now about 37 vaccine doses which have been administered to the Malaysian population. Yeah, just to also have a recap on what we experienced earlier, when COVID-19 actually started in Malaysia, we have a very humble cases of 18, but now we have about, yesterday was about 12,000 cases, but fortunately the trend is reducing, and we are hoping that the number decreases every single day. All right. So the symptoms of COVID-19 basically mimics what you experience if you have the usual cold and flu. So if, we tend to have, running nose or nose block, sore throat, fever. So it's quite similar as what you would actually see in patients who comes in to get medications for cold and flu. But of course, the severity varies. It could be, just a minor cold and flu, and it could be where patient develops shortness of breath. So when patient develops shortness of breath, or patient complains of having difficulty in breathing, then it should be a great sign for us to bring the patient to the hospital, because it could be signs of lung damage. The next one is the variants of the COVID-19. So the variants of COVID-19 actually varies between what are the types of it. So we have, if you heard about variants of concern and variants of interest, so there's actually a bit difference between that. So variants of concern, when we hear in television or maybe in the newspaper, they're talking about variants of concern. What they're referring to is the alpha, beta, and gamma and delta, where the variants of concern spreads very, very rapidly. So it started off with a mere virus of COVID-19, SARS-CoV, but then because when they start to mutate, they have a better way to survive. So they would want to mutate. Of course, virus would want to mutate because they will want to survive as well. So we have cases of alpha and beta variant. We started off as early as 2020. And now we have gamma and delta variant. Delta variant is now the dominant variant in Malaysia and also in other parts of the world, including in US. So why are we concerned with the variants or variants of concern is that it spreads out very rapidly. In fact, in some of the newspaper cutting, they mentioned that Delta variant spreads in seconds. I'll show you the slide later on for the newspaper cutting, but just to show that the infectivity rate or the rate of causing more damage is higher for the variants of concern. But of course, we do have other different types of variants, variants of interest. The latest one that we know is mu variant, which we detected about a month ago. Not we, the researchers, of course, detected about a month ago. And it's now growing slowly in the United Kingdom. And we have one in Philippines as well. The Philippine one is called Theta variant, which is very much causing issues in the Philippines at the particular moment. So how does this virus spread? So as easy as a direct contact, sorry about the blur, not so sure why. Close contact or direct contact. Direct means you touch the person's hand, or maybe you touch the person's face, and it could be close contact, which is about less than 1 meter gap between you and the infected person, or in fact, it could be as simple as touching the surface in contact with the virus. So earlier on, we thought that this COVID-19 actually spreads in a form of droplet, where droplet would be something which is a big drop of water which comes from the saliva or the mucus. So whenever a person sneezes or a person's cough, so there will be tiny dots of water that can travel just a little bit until it fell down because of gravity. And before it falls down, it can spread to other people if they are close enough. But now we actually know that COVID-19 can be transmitted through airborne, where it can form finer particles merely by talking, like what I'm doing right now. I'm talking. So when I talk, there are particles that comes out from my mouth, and that particles actually spreads longer for a long period of time, and it can travel further because it is smaller. So this is the reason why we are very concerned about it, and we encourage people to stay to remain at least 1 meter apart, and also to wear masks whenever they are outside of home. Okay. Yeah, this is the newspaper cutting that I talked about. Earlier on, they thought that a person can be infected from another individual through a close contact, which is less than a meter, with the duration of 15 minutes. But now, because of the emergence of Delta variant and also Gamma variant, it can actually infect people in just 5 seconds. Some newspaper cutting mentioned less than 20 seconds. But it still comes in seconds, and that actually signifies that the virus is airborne. So that means it can travel to the air in any parts of the air that we breathe in. So that is the reason why the infection rate or level of the virus is much higher. This is something that my mom is very, very scared when I work in the Pusat vaccine, because we deal with people, many, I would say hundreds of people every day. So because it can get a person being infected in a few seconds. So that's why we have to take precautions by putting all the safety measures and make sure we don't miss out any important things. For example, wash hands, very importantly. I'll talk about that more into details, but how do we diagnose a person with COVID-19? So there are 2 ways. I don't want to be too technical on that, but what we would do in a hospital is usually, I think maybe some of you are also quite familiar with, is we do the nasal swab. So nasal swab is what we do to detect the component of virus inside the back of the throat and also at the back of the nose. So that will be enable us to detect if there's any presence of the virus. But of course, in hospitals especially, they would do blood samples where when they draw the blood, they will be able to detect the antibody. So we have antibody that will be produced upon exposure to the virus. So once the virus come into our body, then our antibody will be signal, wow, okay, we have a foreign thing here. So we will need to produce more antibody to fight the infection. So this is another way for us to really detect whether the virus is there based on the level of the antibody being produced. Of course, there are different pros and cons based on this, but I don't want to get technical on that. But the part where we would do the complete diagnosis of a person to be having or to be diagnosed with COVID-19 is by using the nasal swab, RT-PCR. Okay. And we can also detect on the infectivity rate of a person, because as you know, a person will be very infective at the early part of the infection, and then they will be much infective, less infective as the time goes. So during the earlier part, we have to make sure that the person is being contained or is being quarantined as much as possible. All right. So it will then bring us to, the worry about how to treat COVID-19. So we treat patients with COVID-19 depending on the severity or the clinical category of patients. So we have categorized patient on 5 different types of category. The first one is a patient with no symptoms. So that means the patient is, feeling, I'm just okay. I got to know that I have COVID-19 because it appears that my office mate got COVID-19 and I was sitting next to him, but I don't have anything. So that is most likely a category 1 without symptoms. Category 2 or CAT 2, patients symptomatic. That means patient with symptoms without lung infection. So what I'm trying to say here is that patient might have sore throat, might have running nose, might have fever, but there's no effect on the lung yet. Okay, so that means when we do X-ray, patients would be the X-ray is actually quite okay when they're doing the X-ray on the lung. All right. And the next part is a category or CAT 3, where patient will come in with lung infection. So usually in this case, patient will be having, a little bit of shortness of breath and also a bit of chest pain. So usually we will bring this patient to hospital and also to treat the lung infection. CAT 4 or category 4, patient who has symptoms with lung infection and in need for oxygen supplementation. So that means this patient would require constant oxygen supply because they could not sustain the oxygen level by normal breathing, respiration. They need the oxygen being supplied to them directly, because otherwise, I think you might have the device, the oxygen to check the SpO2 level at home, the portable ones especially. So if you check if it's less than 95, so something is, a bit wrong. So please go for some checkup for that. All right. But usually, patients, can vary sometimes, even if the oxygen saturation or SpO2 is less than 50, they can just, they can just lead their lifestyle as if they don't have anything, because they don't realize that they have COVID infection at the moment, and the body is trying to compensate with the lack of oxygen. So which what we call as, the happy hypoxia. But I don't want to be too technical on that. But there's also patient with oxygen saturation just a little bit low, but they are already experiencing shortness of breath. So it depends on the individual actually. And of course, for the final category, which is category 5, patients who are in critical conditions with multiple organ complication. So a lot of the organs are starting to shut down because they don't have enough oxygen to sustain. Okay, for example, if oxygen couldn't go to the brain, then of course the brain couldn't function, and therefore patient can collapse. If the patient has damage at the lung, they could not breathe, they could not get the oxygen, so it can cause a severe situation for them. Okay. So the treatment of COVID-19 would be based on the category, as I said earlier. We don't have specific treatment for Cat 1, but as for category 2 and 3, we will treat them based on the symptomatic situation or based on the complaints. If they say that, you know, I'm having sore throat, I'm having cough, so we'll give them cough medicine. Or if they have fever, we will give them fever medication. If they have flu, we will give them flu medication. If they have a lung infection, for category 3, we will also give them antibiotics. As for category 4 and 5, we will put on the treatment into a more comprehensive manner, where we will give them antiviral medication, antibodies to help the antibody in their own body to fight the infection. We have the immunomodulatory. So this term actually signifies the medication that helps to reduce the inflammation. And also anticoagulant, because another problem with COVID-19 is that it can cause blood clot as well. It has a higher risk of a person to get blood clot. All right. I will explain that into details in the next slide. But one thing that we should be less worried about is that in Malaysia, we have only about 1.5 cases of new cases of COVID-19, which are in categories 3, 4, and 5. So mostly the cases comes from category 1 and 2. And the recovery rate in Malaysia, as for now, is about 90.5. So it's slightly lower from the one we experienced in the first wave. But of course, we will try, especially the frontliners, will try as much as possible to increase the recovery rate to reach about 95% or 96% in the next couple of months. And the death rate in Malaysia is about 1.2%, which is lower than the global rate, which is about 2%. So as I said earlier, I'll explain about a little bit on the antivirals. So we would actually give antiviral medication to patients who are in more severe category to prevent the virus from entering and replicating inside the cell. So the virus cannot sustain itself in the blood circulation. Yeah, but it will require itself to enter our cells so that it can survive and it can replicate. The virus cannot replicate outside of the cells. So they need a host medium. So the host is actually the cells. And when they replicate more, and the cells will start to burst, and then there will be more virus trying to enter different parts of the cells in the body. Okay, so what antiviral will do here is to prevent the virus from entering inside our cell and from replicating. We have monoclonal antibodies as well, where this is basically antibody to help the virus from going inside the cell. By, they have the attachment here, they will attach themselves to the virus here so that they cannot enter the cell. So this yellow part here is the cell, and because there's a disturbances in the structure of the COVID-19, they cannot enter the cells. Okay, so the example of the monoclonal antibodies include tolicizumab and sotrozumab. The reason why I mentioned the example here is because maybe for those of you who have, family members, or maybe you have experience hands-on dealing with the medication, to be familiarized with this treatment. And the other part that we also use in the hospital is steroid, because steroid helps to reduce inflammation, where in the situation of COVID-19, we have too much of inflammation inside our body, especially in the lung. So when there's too much of inflammation, the organ cannot function. So this is the reason why we apply anti-inflammation in a form of steroid to reduce the inflammation that causes the organ failure. So the example that we use, it came out in the newspaper many times. We use prednisolone and also methylprednisolone. Right, this is actually one favorite question that people like to ask because we don't have a specific guidelines for ivermectin. So can ivermectin be used to treat or to prevent COVID-19? So as simple as ivermectin is actually a anti-parasite drug. So it actually it has been used previously as anti-parasitic medication for animals. We don't use it for human yet, but recently, especially in the early pandemic, scientists starts to realize that maybe ivermectin can be used based on their laboratory studies. But unfortunately, the studies on human are still scarce and quite conflicting. So the reason why I said that is because certain studies said that it is good, it has an impact of reducing mortality rate, but on the other hand, some studies says that it can further damage a person's organ, for example, kidney. Okay, so because of this insufficient data on the ivermectin, as healthcare providers, we do not want to suggest something which has a lot of uncertainty. We want more certainty to ensure that you have the best treatment. Therefore, you would not see any ivermectin being used in a general treatment for COVID-19 as per guideline. So based on FDA, Food Drug Administration, which is in US, so FDA has not authorized or approved the use of ivermectin for COVID-19. And in the World Health Organization or WHO only recommends ivermectin to be used in clinical trials. Why? Because when a person is in clinical trials, they can be monitored thoroughly for any side effects, and they can be treated then and there. When a person takes, for example, if they take ivermectin, from a supply from their friend or from a neighbor or maybe from a colleague, and they consume it according to their own recommended dose, we don't really know, what's going to happen to the person because we don't have proper monitoring for that particular person. So best to wait for the update. When the update says that yes, it helps to reduce the virus, or to reduce the virus count, or to reduce the virus replication, then surely we will be encouraging the use of ivermectin. But as for now, there's not much data to support the use of ivermectin. But fortunately, the Malaysian government has heard about this, and they have started off their own initiative to conduct a study on ivermectin. So this is very specific on Malaysian population. So the Ministry of Health Malaysia, or KKM, and Institute of Clinical Research have initiated the multi-center study. So that means the study is in many places in the hospital. As you can see at the bottom diagram here, we have centers in Hospital Sultanah Aminah in Johor Bahru. We have one in Alostar, Sultanah Bahia Hospital, Abdul Halim in Sungai Petani, and there's 9 more actually, which are doing studies on ivermectin, but their focus is more on preventing the progress of COVID-19 to severe stages. So that means the focus is more on patients who are hospitalized. So that will be category 3. And they will want to see if they give ivermectin, can it prevent from patient developing the severe stages, which is stage 4 and stage 5. And then at the same time, they will want to see the mortality outcome. That means if we use ivermectin for the patient, will the patient survive more or less? Because we don't have data at this particular moment, so best not to take the ivermectin without proper consent or without proper guidance by the doctor. So the study actually started on 31st of May this year, and it should be completed by now because today marks the 1st of October, but we have not heard of it so far, the update of it. But hopefully they can come up with the report in the next few months after they have done the compilation of the study. Okay, so please wait until then before you want to try out ivermectin per suggestion by some of the friends, because we just don't want people to be in a to develop organ failure or to cause further damage to the body just because of unsupervised use of ivermectin. Okay, so which now bring us to the topic of interest. So the relationship between COVID-19 and Parkinson's disease. So based on the study and based on the swab, they have found that the virus present in the cerebrospinal fluid. So that means that will be the fluid at your backbone. So that means it can actually travel into the brain, because it is already in the pathway to the brain. So the virus has been found in all of the different parts of the body, including lung, fecal samples, and blood samples. So that is the particular reason why when the person unfortunately perished because of the virus, they had to be contained in a specific cover and be protected from their own loved ones. So the loved ones could not even, kiss them goodbye or hug them just because, so that we can prevent the virus from being spread to the other family members. Okay, and SARS-CoV-2 virus, what it does is it engages the host cell receptor called ACE2. So this receptor is actually like a door to the virus. When the door is open, so the virus can come in. Okay, so the receptor is found all over the body's cell surface, including the cells of the brain, and the ACE receptor supports the entry of the virus into the brain cells. So that means the virus will actually enter the cell via ACE receptor. So the ACE acts as a door, and the virus can go into the cells using the receptor, the ACE2 receptor. Okay, so when the SARS-CoV-2 receptor, the virus enters the neuronal cells, then what our body does is it will trigger the immune system. So when there's this kind of virus presence in the system, the immune system will start to be active, and then it will start to become overly active. So when there's too much of activation in the immune system, it will cause inflammation. So the inflammation is where people, complain about, I'm just having difficulty in breathing because part of the lungs are quite damaged because of the inflammation. And when the immune system becomes too activated, it also promotes the blood clot in the brain. And when the clot is present in the brain, it will reduce the oxygen being supplied to the brain as well, because clot can also block certain parts of the brain. And also if it's in a worse kind of situation, it can cause patient to develop stroke because of the clotting in the brain. right? So hyperactive immune response. So when there's a surge in the immune response to the viral infection, it can cause inflammation to the brain. Okay, so not only inflammation can occur in the lung because it can go to the spine via the cerebrospinal fluid or CSF. It can then go to the brain and cause inflammation in the brain itself. So that's why we also see that higher mortality rates in PD patients who have COVID-19 higher as compared to other patients. So what does that mean is that having PD would create more difficulty in COVID-19 recovery. But that doesn't show that a person could not recover from it, but maybe they will need more time and more treatment to treat the particular patient. Okay, based on the study in the University of Iowa, which is in US, they showed that they found out that people who with PD who contracted COVID-19 has 30% increase of death from the virus. So they found out that the cause of death are usually because of the pneumonia. So pneumonia is the lung infection, and the cause of death for patients with PD is because of the pneumonia or lung infection. Why does this happen? Is because PD patient can have difficulty in swallowing, or sometimes they accidentally choke, which can also further aggravate the pneumonia situation. But of course, if it's detected early, then we can treat pneumonia early because we have means to treat pneumonia. But it should be detected early, and we should prevent organ damage as early as possible as well. So once we come across situations where it is questionable that a family member of us may have contracted the virus, so we should do self-isolation very in the early part of detection, and also we should inform the healthcare providers about the exposure as well, so that they know how to advise you on what are the next steps that you should take. Okay, so early detection is mandatory for better survival rate. In another study in Italy, they have reported that motor and non-motor symptoms seems to be worsened with COVID-19. Usually, it is related to the presence of the virus in the brain that causes inflammation. So remember the inflammation, when there's too much of inflammation, it can create scar, it can cause the blood clot. So it will then worsen up the motor and non-motor symptoms. And the usual symptoms that they have encountered is the slowness in the movement, tremor, and spasm. And in most cases, in 1/3 of cases of PD patient with COVID-19, they will need the medication to be adjusted. Why? Because a lot of them will complain that, early on when I take Madopa, for example, my tremor symptoms have been, quite well controlled. But ever since I got this COVID infection, I keep on getting tremor again. So that actually signifies that the medication needs to be adjusted, and maybe the dose will need to be increased to control the symptoms again. So what we can summarize here is that the mixture of COVID-19, Parkinson's disease medication, and also the increase in the immune response because of the COVID-19 create a perfect storm, or create a situation that will further worsen up the PD symptoms. So what is then the direct impact of patient with COVID-19 to a person with Parkinson's? So especially for healthcare providers, the challenges is that when a PD patient comes in the ICU, where we will need to strictly monitor giving out extra precaution for respiratory complications because they are prone to develop pneumonia and any opportunistic infection. So therefore, healthcare providers will need to give out extra caution because when there's detection of pneumonia, they will need to treat them early on to preserve the lung. Okay, and secondly, this is also something that the healthcare providers need to be cautioned about, especially for the medication which is given for infected PD patient. Why? Because when they introduce something, for example, if they introduce remdesivir, which is the antiviral, if they introduce one medication, would they interact with the medication that the patient is concurrently having? Or if we are giving supplement, for example, to the patient, would it have any interaction with the medication that they are currently taking? So we would need to know all of that so that we don't cause a problem to the patient himself or herself. Right? So in ICU, for example, so we have pharmacists who will be on standby to check, say the doctor mentioned to them that, yeah, I'm going to start this patient on a steroid, for example. So the pharmacist will need to check whether the steroid can be used with patients who are on some other medication. So this is also not only for patients who have PD, it could be for patients who are having other diseases, including diabetes, including patients with heart failure, patients who had stenting earlier, who are on aspirin. So there's a lot of possibilities that can happen, which can cause potential interaction of the drugs. So we will want to prevent that. This is preventable by the presence of pharmacists who will be doing the medication screening. Okay, the next part of the direct impact is that elderly PD patients and those who have other medical issues are at risk of severe COVID-19 infections because, for example, for elderly patients, because the immune system is slightly lower compared to the other population, so the risk of damaging the organs are much greater compared to other population. So again, usually we would give more caution to patients who have different medical condition because we know that with one step can cause 10 times damage compared to a person with no other underlying medical issues. And the other part is that further neuron damage can happen in COVID-19 infected PD patients, where when there's a neuron damage because of the inflammation, it will then worsen up the symptoms, the tremor, and the other symptoms which is associated with Parkinson's disease. Okay. As for the indirect impact of COVID-19, would be because there's a disruption in healthcare system and also patients' care. So why does this happen? Because of the MCO. So unfortunately, the MCO regulation has been lifted a lot in these recent weeks. But previously, when we have implemented full MCO, a lot of patients could not go to the hospital to seek for medical help. So not only PD patients, for different kinds of patients as well. I've had one patient who actually come in to Pusat vaccine. So he said that I've been waiting to get surgery for my brain for about a year. So he said that, you know, I could be dead in the next couple of days, but because they just couldn't support the clinic to cater diseases which are non-COVID cases. So this is an unfortunate situation that is happening at the moment. And limited clinic hours, a lot of the clinics, especially in privatized clinic, they only open the clinic up until 1 o'clock. And then it used to be, until 5 o'clock, and it used to be until Saturdays and Sundays, but we don't see that in the earlier MCO. So a lot of the patients follow-up has been much delayed because of that. And we have reduced hospital admission because a lot of the wards have been shifted to COVID-only wards, and certain hospitals are being closed, especially we have Hospital Ampang, earlier Hospital Sungai Buloh, we have Hospital Sedang, not Hospital Sedang, Hospital Ampang, Sungai Buloh, and Hospital Selayang, which have been closed just to cater for the surge of COVID cases. So a lot of the patients had to wait for the new rules that will allow them to come to the clinic for their own follow-up. Okay. The next part is the next indirect impact is PD patient care, PD care, which had to be transitioned to telemedicine visit. So this is especially true for private sectors, where they sometimes will encourage telemedicine visit because of inability for patients to travel across the district. So this is very much for during the earlier MCO, where patient could not even go beyond 20 kilometers. So when that happens, they still want to see the doctor. Unfortunately, the doctor had to maintain in that place. Maybe they are supposed to visit the doctor in KL, but their home is in Subang Jaya, for example. So the only way that they can meet the doctor and to discuss about the follow-up is by telemedicine. But unfortunately, telemedicine cannot be applied for government healthcare system because we have just too much of patients. We couldn't afford for that. We want to, but we don't have enough manpower to support that, unfortunately, until now. The third indirect impact is that COVID-19 also caused delays in the research, especially on the Parkinson's disease research. Why? Because we have less patient who comes into the hospital, and because of the limited clinic hours, we cannot recruit patient, we cannot do the study. So when we cannot do the study, we cannot come up with a solution that can benefit the PD patients as for now. But hopefully, because of the ease of the MCO regulation, hopefully a lot of the research are back on track and they can conduct the clinical studies and come up with the outcome, a good outcome for the future of the PD patient. Okay. The next part is preventative measure negatively impact PD patients' mental health, where when they have, because they have limited recreational activities, and unfortunately, maybe some of the family members had loss of job, they were terminated from the company because the company couldn't sustain anymore. It created a lot of tension. The husband will be angry at the wife will be angry at the husband, he will be angry at the parents, and it creates a lot of tension in the family. And I mean, if you can see it quite clearly, that a lot of divorce actually happened, especially in these 2 years of COVID, unfortunately. So this is what is the reality that is happening in Malaysia at this particular moment, but I'm sure it's affecting all of us throughout the world. This is a newspaper cutting, also to show that the government do realize, our new Ministry of Health government do realize, Mr. Kari Jamaluddin do realize about the backlog or the delay in the treatment of non-COVID cases in the Ministry of Health facility. But unfortunately, it happens in different parts of the world as well, because they would want to prioritize to control the COVID cases, which unfortunately at the same time delays out the treatment for the non-COVID ones. So a lot of procedures Example, the eye procedures, patient who had need to go for reconstruction of the heart, patient who will need to seek for who will need to go for surgery for the prostate had to be delayed because they just don't have enough place and enough manpower to conduct the medical checkup. Okay. So when that happens, what are the effects of COVID-19 on the physical well-being? So we have to take this as a whole spectrum where the person will start off being self-isolated because they are still unknown whether they have COVID-19, and then it will progress to where they are having COVID-19 and they are experiencing these symptoms. And after COVID-19, that means after they have been released out from the ward, they might actually have they might still have the impact of COVID-19. Okay, so what I'm explaining here is that, for example, patient will have worsening, might have worsening of motor and non-motor symptoms because of the COVID-19 itself, which means that the virus causes the inflammation and then damages the neuron, or the inability to get proper medical checkup. So they can't get proper medical checkup, they cannot get the proper medicine, and therefore it creates out the worsening of the symptoms of PD patients. And the next part is complication of COVID. Some patients actually complains of respiratory issue where they said that, especially for post-COVID patient, I just don't breathe as normal as I breathed before. When I walk a little bit, I already feel breathlessness. So this happens after COVID. So why does that happen, and why it happens in certain patients and why it does not happen to some other patient? So it depends on the act of the virus itself and also the inflammation. If the inflammation is irreversible in the lung, so that means the damage in the lung would be continuous, unfortunately. But of course, when the lung is not compromised during the COVID infection, so the lung is preserved from the damage which is caused by COVID, then surely when patient recovers, they will say that, I'm feeling okay, I'm breathing quite okay, and I don't have any problems doing my activities or even doing recreational activities as usual. So the complication varies, and it depends on how much damage that the virus actually attacks our organs. And not only that, if there's death or there's a loss of care provider, unfortunately, so what happens to the person with Parkinson's disease? Can they survive on their own? Who's going to take care of them? So there's a lot of question mark, and that is present in that particular situation. So this is also quite unfortunate, especially for babies who were born by mothers who had COVID-19. So I think that maybe some of you may have heard about a celebrity who passed away when she was pregnant at 30 plus weeks. She unfortunately perished because of the virus, but the baby survived, fortunately, and the baby had to be taken care of someone else because of the loss of care provider. So this is a situation, this kind of situation actually are being faced by not only a certain number of us, but a lot of us in Malaysia and throughout the world. And not only that, some patients might be quite malnourished, especially in a situation where they don't have lack of nutrient or well-balanced food, especially if they're home quarantine. They could not get a proper source of food because maybe they just don't have money to buy. They don't have people to help them. So it can create a situation where they don't have enough nourishment to sustain. So sometimes it can be to that point as well. So this is the impact that because of COVID, it can cause this kind of impact to patients. And not only that, in terms of mental well-being, patient can be depressed, especially if they're living in a sedentary lifestyle. If they're living in sedentary lifestyle, it can cause them to have less contact with the loved ones, especially, you know, for some of the B40, unfortunately, they don't even have the means to buy a credit to call the loved ones or to inform the loved ones. So it can create, you know, a depressive situation where they can feel that they are all alone, you know, surviving alone. And not only that, some patient can be having an anxiety episode as well, where they will be very worried about getting infected, or if they're already infected, they'll be worried about the complication of COVID, or if they are not infected, or if they have been infected earlier and they have recovered, and they will want to go for vaccination. So can I die because of vaccination? So some of them actually ask me that when I work in Pusat vaccine. So can I die because of the vaccine? I don't want to die because of the vaccine. It's already too much, you know, to deal with COVID-19, and now I have to face the problems with vaccine. But we'll talk about that in the next couple of slides. Do not worry. And the next part is post-traumatic distress syndrome, where they might have bad experience with the situation of COVID-19 infection. For example, they had to be intubated and they had to be slept, you know, put on sleep, where the family members do not even know whether they can survive or not. So there's a lot of, you know, stress related to that. And when the patient wakes up, what's going to happen to them. So a lot of that can actually relate to what patient can experience in a form of post-traumatic distress syndrome. And sometimes in the ward, they might say that, you know, I've not been able to breathe for the past couple of years, and I feel that, you know, my life is just at the tip of the needle, and I could die, you know, at any time. So that can actually create a very traumatizing experience for the patient, even though they fortunately survives. And the other part about mental health is that burnout. Burnout is experienced by many people who work as a frontliners, especially those who work in the hospitals, where they had to deal with the uncertainty of whether they would be infected or they would not, because, you know, we just don't know. Patient can come in with saying that, you know, I don't have any virus, but it turns out that they have virus and they are spreading out to the other healthcare providers. And we have many outbreaks. For example, the one in Alogaja, I think about a couple of months earlier, where it started off with one nurse, and the outbreak causes infection to many layers of frontliners. So a lot of them had to be quarantined. So those who survive and those who do not get the virus, unfortunately, had to cover for the work of the other frontliners who had to be quarantined. So it creates the experience of, you know, tiredness. I've been working a lot, but I still have to work a lot more, because otherwise, who else can do it? And the other part is burnout, which I think that has not been mentioned a lot, is the family members who have the loved one as frontliners. For example, if I'm the mother and I have a son who is working in Hospital Sungai Buloh at the moment, so if he comes back to my home, would I have to be worried about my son get infected? Should I be worried about this? So it creates out, you know, that level of tightness and depression, and also, I guess, a mixture of anxiety. having to deal with a lot of uncertainty, and what happens if something like this happens, something like that. So it creates out, the tiredness. And I actually talked recently to one of my friend who is a anesthetic specialist in Hospital Kuala Lumpur. She said that, the physical tiredness is not the one which bothers them a lot. It's the mental tiredness that causes them burnout, because, they had to deal with the part where they are treating 10 patients already in ICU, for example, and there goes a wave, 5 more patients comes in, and they're still not done with the 10 patients in ICU at that moment. So when there's surge of cases, and it's like they are totally helpless in surviving, but they still had to do it, because otherwise then who else can? So they keep surviving by asking, if I don't do it, then who else would? But really kudos for them for, being frontliners and being the sole supporter of the country. So the common symptoms of mental health is something which is very important for us to detect early, so that we can seek for help as early as possible. So a lot of the symptoms that may be faced by people could be continuously feeling sad or low in the mood, feeling hopelessness or getting tearful for no reason. And this is very prominent. No motivation or interest in things that, the person used to enjoy, and constantly being on the edge. They get quite anxious easily, and they get tense quite easily as well. And some who are in a severe mode may have thoughts of harming themselves as well. So it is very, very crucial, not only for healthcare providers, for everyone, including you and me, to really detect if we are having, this kind of symptoms. We should seek for help as early as possible. So some of the risk of the physical and mental stress is because when you live alone, you don't have anyone to talk to, you hold a lot of problems to yourself, and you don't know the outlet to share it. So, and sometimes people might overthink, especially when they're alone, and it creates a lot of depression issues with that. And also because of the marital status, if you have a good marital status, then your spouse and you yourself can support each other. Otherwise, if one person doesn't support, then of course it can create more problem and more stress to that particular person. And of course, if the person used to be employed and now the person is not working anymore, it can also double up the stress to them. And in terms of education background, if they don't have a lot of education background, they don't have a lot of knowledge on COVID, so it creates out the anxiousness of uncertainty. I don't know what's going to happen if I go outside. I don't know what's going to happen if I drink this. So there's a lot of uncertainty there, because there's a lot of things that they don't know about. On the other hand, if the person has, a lot of good education background, I would say, they might have a stress as well, because I know too much and I'm foreseeing this complication that's going to happen to me. So they worry too much as well, because they know a lot of things. So it goes on both ends as well, which causes the risk of the stress. And if we have opportunity for socializing, where if you can talk to a friend, if you can talk to your family member, then it will be okay, because you have an outlet to share. You have the outlet to relay your worriness, relay your troubles, and maybe the person can also share the burden. But unfortunately, for certain cases, again, I would need to emphasize, especially on B40, that I've seen a lot in Pusat vaccine, where they don't have money for socializing because they have barely enough to maintain their life for food. And sometimes not even enough money to buy food. So that's why you would see a lot of, newspaper saying about, the white flags, people need help. Some people really need help during that time, because I've seen people who do not have money to even to go back from the Pusat vaccine, or even to go back from the hospital. It can come to that extent as well. We might be blessed because we have the means to support. We have the internet, we have a telephone to call, our sister, our brother, our children to, talk about this and that. But in cases of people who are less fortunate compared to us, they don't even have this kind of privilege. So I think that this COVID situation should also, give us some thinking towards others, and maybe if we have the opportunity to help others in small ways or in any way, we can do that, or yeah, we should try to do that. So if we ever come across that situation, so the next question is to think about, how do I manage this? How can I manage this? So there are a few things that we can do if you do follow up in a private setting, and if you have the means of having a good online communication, you can definitely continue on with telemedicine. Although telemedicine will not be, a very direct translation to, you cannot talk to the doctor directly, so you're doing telemedicine, but it's not really as good of a feeling as what you would, experience if you talk directly to the healthcare providers, right? But in this situation, of course, the best mean is to use the alternative, which is in a form of telemedicine. And if we can't do that, then we can do a regular contact with healthcare team or CAC to ask them about, so if I'm experienced this, so what should I do? They have the means to advise you on that. And make sure if you are able to go back to the hospital, do the reassessment of the medication, especially during the clinic visit, to make sure that the dose that you're taking at the moment can well control the symptoms. And not only that, make sure the signs of anxiety and depression is being monitored closely, so that if one need to seek some help, we have the means to help them. We have many society that can help to tackle this situation. And not only that, besides monitoring for mental health situation, we should also watch out for physical symptoms. For example, if the person suddenly develops shortness of breath or chest pain, that will need us to bring the person to the hospital immediately. And of course, I have emphasized this many times, but I'm keeping on re-emphasizing, to protect yourself by following proper SOP. Okay, so this is the education pamphlet that was, I actually took it from the Ministry of Health website. So this pamphlet is often given for patients who are discharged from hospital after COVID-19 treatment. So what I would like to emphasize on is the one that I boxed in red, where consider protection for household members over 65 years old or with underlying illness. Because sometimes we just don't pay attention to this. We think that, oh, I can go and visit my family member. But please consider that they are persons who are at risk of severe COVID. So we need to consider protecting them against the COVID, and avoid and limit the number of visitors at home, and avoid going to crowded areas, especially in the hospital. If you have appointment time, specific appointment time, go at that specific appointment time, and then go back immediately afterwards. Okay, and if there's any disturbances, especially in the emotional during or after COVID infection, there's a hotline under Talian Sokongan Psychosocial COVID-19 under the initiative of Ministry of Health and Mercy Malaysia. So the people, I mean the person who wants to seek help for that can always dial the number. And not only for the mental situation, any medical attention that requires immediate attention should be sent to the hospital directly, especially shortness of breath, chest pain, blurred vision, sudden blurred vision, and severe headache, severe unexplained headache. Because if we don't bring to a hospital, it could be a life-threatening situation that needs a prompt investigation and treatment. Oops. Okay. Okay, this is also another question which was asked to me many times before, but I'm hoping that all of you have been vaccinated, fully vaccinated, and got that yellow medal certificate. But is vaccine safe for PD patient? So specialists worldwide have agreed that people with PD should get vaccine with few exception. So what I'm saying few exception is if the patient has history of severe allergic reaction, for example. They used to receive one vaccination before this and they develop severe reaction that causes them to be hospitalized. So of course, there would be some exception for certain category of groups. But besides that, everybody should be encouraged to get the vaccine. And the vaccine is safe for people with PD, and there is no interaction with PD medication. Why we want to encourage vaccine is because PD is also one of the category included under clinical risk group or category. So that will also include the other diseases or other conditions. For example, I've accepted patient who had stenting, who just had stenting about a couple of months ago, a couple of months before he is due for vaccination. So we have released a lot of patients who had diseases, kidney diseases, for example, who can go for vaccination. But of course, talk to your doctor first. Make sure your doctor gives out green light. As there are, although rare, exception for those who cannot receive the vaccine. Okay, this is just to show some photos here. This gentleman here can now fortunately eat ice cream at the stall because he got that certificate, the promised certificate. And I guess you have been in a situation if you have gone through the Pusat vaccine. And this is me in the middle picture in one of the Pusat vaccine in the Mega PPV, working as the consent taker for one of the days. So again, we should be encouraged to get vaccinated so that we have a means of protecting ourselves against the complication of COVID. So the vaccine is partly to protect ourselves from getting infected, but it's not guaranteed 100%. So what the vaccine, the objective of vaccine is more towards getting our body ready if we ever encounter COVID in the future. Because a lot of the complication happens because the body doesn't know how to react. The body is not ready to fight COVID. So by giving the vaccine, it helps the body to adapt and react appropriately upon exposure to COVID. Okay, this is another question that was asked to me many times. So should I take supplements to prevent COVID-19? So the data is still insufficient, but nonetheless, I mean, if I'm speaking to my colleague who is working in community pharmacy, the sales of supplement has increased since the emergence of COVID because patients or people wondering whether they have enough vitamins or minerals for the immune system, because as you know that certain vitamins and minerals are important, and if we have lack of them, then it will increase the risk of infection. So basically what makes them want to take the supplement is, number one, to prevent from COVID-19, and number two is if they got COVID-19, they would want to reduce the severity and also to shorten the recovery period, and also to prevent from getting long COVID. So long COVID, that means a long extended time of COVID infection. So should I take supplement? I would say yes, if it doesn't have any contraindication, and if you know that you have lack of that, especially if one doesn't eat a lot of balanced food, less vegetables and fruits, for example, but ensure that the supplements do not interact with your medications. If you don't know whether it can interact or not, ask your pharmacist or ask the doctor if you're unsure. And supplements are definitely not a replacement for social distancing and safety measures. So do your diligence to follow SOP strictly and to protect you and your loved ones. So how do I prevent COVID-19 spread? I'm sure all of you are quite aware of that. We wear masks, we avoid crowded places, we wash our hands frequently, and avoid contact. So a lot of this have been explained many times. So make sure you remember it by heart and always do it, if not all the time, almost every time. And when you have done that, but unfortunately it happens, still get COVID. So what should I do if I got infected? So first thing first, do not panic. So what you need to do is go to the CAC, physical CAC. There's in the website, there's a list of CAC that you can go. I will share it in the link. Maybe if you want to see it. So we have in Selangor, for example, we have many places, especially in the district of Petaling. We have one in Stadium Melawati. This is a very big place and a very crowded place as well. But if you need to go, please look for the information here, which is the nearest to your home address. Okay. And if one is experiencing breathing difficulties or requiring any emergency treatment, go to the nearest hospital. So I have a homework for you. So what you need to do is to know what is your nearest hospital. So after this, you can try and maybe Google or ask your family members to help you Google what is the nearest hospital to your home and save the contact number, because we never know when that situation may happen. But if it did happen, then we know how to do it. And find the fastest route to go to the hospital. So you might need to know, okay, the shortcut is like this and this. So we have to be prepared for emergency situation. So it's not only for COVID, it could be for anything else. Okay, so the helpline CAC is as such, but it's also available in the website. So you can find it there. It's open from 8 AM to 9 PM every day. And so we are at almost the end of it, almost the end of the talk. So PD patient, especially for those who are elderly and with other comorbidities, are at higher risk of having severe COVID-19 infection. Therefore, severe precaution should be given to PD patients, especially on the signs of physical and mental exhaustion and mental and distress. The treatment and preventive measures should be given appropriately. Okay, so I guess that will be all for my talk. Thank you so much for listening. And I open up to question. I've seen somebody who raised hand earlier. Yeah, if you want to address your question. Maybe Dr. Ng will want to say something first.
Nothing much from me. One question I want to ask you is the death rate mostly occur in which category patients? It's later the 3, 4, 5, is it?
3, 4, 5. Yes, the death rate is more on category not 3, 4, and 5 actually.
Okay. Okay. Any question from the floor? I mean, you feel free to ask anything that you want. Sarah actually asked a question in the chat, but I helped to answer that already. So basically, she was asking whether Pfizer vaccination would cause deterioration of the of some of the things like stamina, balance, and focus. Yeah.
Okay.
So I found the explanation is that the inflammation will affect the brain. If you take vaccine, everyone will have different inflammatory response. So some people might develop a worse situation and then causing that effect. Yeah. Thank you, Dr. Ang. Yeah. See you later.
This is a very rare event. So I would say that Pfizer has the least of the worries among all of the vaccines compared to the AZ vaccine and also depends on. Sorry, there's a question.
Is Mr. Kwan, you have anything to ask? I mean, those who feel that typing would be better can also do so. So you can try to click on the chat below. You see the icon chat there. You can click there and then type your question. It's also one way to ask question. Another way is you can just turn on your mic and just ask.
Maybe I'll share you the experience that a patient complains of in the PPV, where when I work in PPV, which gives out AstraZeneca vaccine, a lot of them are very concerned about the blood clots, because we see a lot of blood clot cases. Not a lot, but there are some cases of blood clot. So a lot of them are very, very reluctant because of the clotting issues. But what we found is that the clotting issue which happens in AstraZeneca vaccine is much less compared to you develop clotting when a person has COVID. So you would have a higher risk of developing clot if you got COVID compared to you developing blood clot, having blood clot because of the vaccination, because of the AstraZeneca vaccination. And so far in Malaysia, I've not heard of it for the blood clot side effects. So maybe it's regional based, we don't know, but so far we have not heard of any.
Sarah, you muted yourself.
What I meant is that, I mean, just now what you were saying is the physical aspect, the after effect of vaccination. But what about on the mental well-being directly, that it will create kind of like erratic behavior, immediately after the vaccination? Does it really happen? Or, it could be just other indirect factors, like COVID-19, not vaccination, that cause you the mental health problem, but not the direct impact of the vaccination.
I think to answer that, because we don't have studies, a lot of studies to really relate about the erratic behavior due to the vaccine. Although Dr. Ng has mentioned about there are some reports, but we can't really say that because of the vaccine itself, it causes the changes in the behavior. Because it could be anything else. It could be even COVID that can cause that. It could be the surrounding environment that changes and that made the person upset. It could be anything.
It means there are other underlying issues, but not the direct impact of the vaccination.
Yes.
That, it could be the overall and, like COVID-19 situation and all that caused that kind of mental well-being, not the direct impact of the vaccination.
Yes, that is true.
Is that what you know? Thank you. Because we have a real case, like that the person with Parkinson's who claimed that his erratic behavior was a direct cause from that vaccination. It started the day after. So it's just like, just curious.
Is he getting better now?
We have yet to see.
Oh, okay. Because if it is caused by the vaccine, the inflammation, it might subside, and then
Yes.
the situation might become better.
Okay.
It's been 3 months after.
Maybe okay, that is if you are talking about the side effects, so side effects vaccine is divided into two main categories. One is the immediate ones and the other one is the delayed ones. So the immediate ones is something that we can actually observe, where you remember that we are supposed to sit for 15 minutes or maybe half an hour, depending on whether the doctor or the pharmacist asks you to do based on the history taking. So that will be immediate, where the reaction from your body against the vaccine will react almost immediately. So that means after 15 minutes, if you don't have anything, basically you're good to go. But the side effect, of course, including AstraZeneca ones, which is causing the blood clots. I'm giving example of the blood clot, can actually happen much later in the next couple of weeks. So it's not really that immediate. So based on the study that they've done. So what I would normally advise for the patients who's taking AstraZeneca vaccine would be to monitor yourself for the next few weeks, at least up until a month. If you are experiencing a sudden blurred vision, or maybe if you have sudden shortness of breath, or so blurred vision is because if the clot goes to the capillaries of the eye or the vessels of the eyes, it can cause blurred vision. If it goes to the lung, it can cause shortness of breath. If it goes to the brain, then a person might actually develop a sudden headache, sudden unexplained headache. So if that happens, then they should actually go to the hospital to seek for medical treatment, because blood clots is a definite emergency situation, and it could be life-threatening as well. But as far as other erratic behavior of the vaccines are concerned, we don't have data to support that it really correlates with each other. It could be, a multi-level factors that can cause a person to be that way. Yep.
Thank you.
No problem. Other questions? I hope that everybody is vaccinated by now. Okay, Mrs. Leong wants to ask some question, is it? But you're muted. Can you?
Oh, can you hear me now?
Yes.
Yes.
Can you hear me now?
Can.
Yes.
Hello?
Can.
Hello, can you hear me now? My question is about booster shots. What is the status on that? And should Parkinson's patients be on the priority?
For the booster shot, they are still doing studies in other countries. So far, we have not done the booster shot yet, because as for now, I'm not so sure until now. They're still doing the study, but when I was working last time, they are doing study to see the level of our antibody to fight against COVID for the next couple of months. Can you hear me?
I think I couldn't hear her anymore.
Oh,
I think the question was asked because recently newspaper is still saying that Kyrie is planning to give us a third shot, booster shot.
yeah, but I think that the study may have been completed, but they might come out in with certain recommendation in the next couple of months, but we don't know yet what is going to happen. But of course, booster shot will be given priority to what we have done so far for the previous vaccination, where we give the people who have comorbidities or elderlies to be given the shot first.
So that means PD patients will be the first batch, likely to be.
It will. I would say that the booster shot will probably be given first to the frontliners and also the vulnerable people.
The newspaper even say that it's likely to be a mixture of brands. So that means if you took AZ previously, the third booster will be a different brand.
Oh.
They say that lah, but it's not confirmed yet. I don't know why the newspaper announced it so early. That it's not really well thought yet. So I think they will have to look at more clinical data first.
Yeah, a lot of countries are doing studies on that. So, but our countries have not done it so far. So we are quite hopeful that once we got more information, more definitive answer to that, then surely I would say, we have to go for it, because booster shot is to extend the protection of oneself, right, against the COVID, because we don't know how long our antibody can protect ourselves against COVID based on the 2 shots that we were given earlier. Because a lot of these are still new, not only new to us, new to the researchers as well. So they had to work one step at a time as well to determine what comes next.
I want to say that the WHO actually don't like the idea of the booster because they say the world is still having vaccine shortage. They should prioritize giving the third world country the vaccine first rather than spending them on a wealthy country to have the third booster. But I think in Malaysia, I read the news that currently we have more than enough vaccine for our own citizens.
Yeah, I think we are already at 90% at reaching herd immunity. So it's actually a good news for all of us. And as you can see, the trend of COVID-19 cases are reducing, although not as much as we want to for now, but it is reducing. So it's something promising for us in the future. And hopefully, even if it cannot be eradicated for the next few years, it can be controlled and we can live well enough to sustain our life together with COVID.
Cheryl, you have a question?
Cheryl wants to say something.
Okay.
I have been having this shortness of breath for a long time now, maybe for more than a year. So how do I know whether it's due to COVID or due to what? No. Because this shortness is caused by my back having a sclerosis. I have sclerosis of my back, and so this has affected my lungs. So how I don't know how to distinguish whether this is due to COVID or due to what?
If you have experienced it for more than a year, I would say that is not because of you're talking about the vaccination, is it, or the COVID itself that causes
COVID? The COVID.
It could be, it could be undetected thing, because as what I said earlier, some people might not even have any symptoms, and it's for them, the body adapts it as the common cold and flu. So we do not know until we can actually do a detection where you do the swab and things like that. But of course, when you have experienced that for already a year, it could also be some other medical attention that you might want to look upon. Maybe it's because of something else as well, because the virus could not live in your body for a long period of time. It will die eventually. But why some people actually perish or maybe die because of this is because the virus replicates too much and causes too much damage before the body can actually heal by itself.
So that is, if I have the shortness of breath, but it goes away after a while. It is a COVID lah.
It's most likely not COVID.
Okay. Thank you.
No problem. But if you are concerned about maybe suddenly you will develop some symptoms of a cough or shortness of breath, sudden shortness of breath, then surely you can go and seek for medical attention, and they can definitely do a swab for you to at least put your heart at ease, so that, oh, okay, I'm so sure that I don't have any COVID. Because otherwise, I keep thinking that, you know, whether I've got COVID or not, we don't know. Yeah. All right, any more questions for me?
Mr. Leong, you have any question because you raised your hand? Leong Choi Moon. Sorry, you muted yourself. We can't hear you. You need to turn on your mic. No question. Okay. Any other questions from the floor?
I don't see any more questions in the chat. So, yep, if you have any question, you can address to me now. Mr. Long say good, so he got no questions.
So maybe after today's session, we will upload it to YouTube and provide the link to Sarah.
Sure, and also maybe I'll just share my screen for a bit if you can. Let me see. Share screen. So please drop us your feedback. If you can scan the barcode, you're more than welcome to do it. But otherwise, I will paste the link in the chat box.
Yeah.
Yes?
I just want to ask, you said to do the nose test of the, you have to go to the hospital or we do it on our own?
The nose swab. Yeah.
Nose swab, okay.
Do we go to the hospital or we do it on our own?
It's better for you to do it at in the hospital. Nose swab is often done in the hospital. Usually what we have in the pharmacy is the rapid test. So the rapid test may give some false positive because it uses your saliva mostly. So if say that the rapid test give you a positive, it could be positive or negative. But if it's negative, then definitely it's negative. But if it's positive, then you will need to go to clinic that can provide RT-PCR test, where they will do the swab at the back of the nose and at the back of the throat, so that they can identify whether you are actually having COVID or not. Because there's a way to do the swab actually. It's really at the back of the nose, and it's not something that we would do it on our own. Yeah. No problem. Any other question for me?
I have a question. I'm not sure whether you are able to answer this or not. Let's say if you go for a check, go for checking for infection, what is the cost currently? The fee that roughly we have to
for
pay?
the checkup or for to detect the COVID, the RT-PCR?
I don't know. When we mention checkup, is this same as doing the nasal swab for the RT-PCR? No.
Maybe I will delegate this explanation. Okay, so when you come into, for example, I give a private setting lah, so it's easier to come into the course. So if you go to private setting, they will isolate you in an isolated place, right? If you know, I mean, if you have seen hospitals, they have one kemah outside, and they will isolate people who have who potentially have COVID, and they will need to wear the gowns. Remember the protective gowns, like a astronaut suit, that one. So they will charge you for that. When they come and see you, they will charge you for that. Usually it costs around 60 ringgit to 80 ringgit for their suit, not your suit, for their suit, because they will be seeing you. So that is already one particular charge, and of course the consultation of the doctors is another thing. And then when you say that, yeah, I might actually have the COVID, so what the doctor would do next is to do RT-PCR. So the RT-PCR varies in different settings, but it will cost around 200 to 300 ringgit. Last time it can cost more, but now I think it's roughly around 200 and 250 ringgit per swab. Okay, so and also if you have some problem with, you know, your breathing, maybe you say that, you know, I'm having shortness of breath and stuff like that, so they might actually suggest you to do x-ray, which will cost you money as well. So the x-ray can merely cost, I think, about 100 to 150 ringgit per x-ray. So if you accumulate, it will easily be at least 500 ringgit in emergency department itself, in emergency department. But that would be depending on if you, okay, maybe the doctor say that, I think you need to be warded because your lung is not really looking nice here. So I want to put you in the ward for more observation. So that will definitely cost more. Every time they come in to the ward to see you, they will charge you every time for the suit, and they will charge you for the swab and basically everything else. So easily, when a person has stage 3 COVID, who is not intubated, can cost 20,000, just like that. 15 to 20,000, as easy as that. This is in private setting lah. But if we're talking about intubation and, you know, very technical things that the doctor will need to do for the severe COVID cases, so that would easily cost 50,000 and more. But in government, it's still free lah, free for Malaysian citizens.
But when we are leaving the border, that means when we are leaving Malaysia, what we have to do is we have to do the PCR result of it.
I think they made it compulsory to do rapid tests, but I guess it depends on the country that you're going to. Some countries would actually be very specific on the RT-PCR test.
So that means we will have to do it our own,
yes,
rather than do it on the spot, not in the
yeah. They will say that, you know, since you can afford traveling, so you can definitely afford for your for your test as well.
Right.
I've had one patient who comes in Pusat Vaccine. He's a Japanese citizen. He wanted to go back to Japan, but unfortunately he can't because he could not get his name into the vaccination, the My Sejahtera list for vaccination, very specifically for AstraZeneca or Pfizer. He keep on getting Sinovac for 3 times. Because of because of the requirement by the country. So again, it depends on the requirement of the country that you're visiting as well, or you are going to. And there's one for Muslim who wish to go for pilgrim, the Hajj in Mecca. Earlier, they only approve those who get certain vaccination, Pfizer, AstraZeneca, and Johnson & Johnson, and there are other lists of it, excluding Sinovac. But now they have also approved Sinovac vaccination for those who wish to perform Hajj or Umrah program. So it depends on the country. Yep. Any other question?
So I hope you guys get the message that the ivermectin is not something that you should take without consultation with the doctor. Yeah, because my father do have a friend constantly taking it, even though he doesn't have any COVID infection. So I don't know where he bought it, maybe from Shopee or Lazada, and then he's taking it every day as a preventive measure. He thinks that by taking ivermectin, he would not get COVID infection. So and my father tried to stop him, never succeeded. Yeah, so couldn't stop him at all. So he's still taking it until today.
And no side effect.
So far he said he's fine, but all we know that he's doing liver damage. And then there are two versions of the drug. One is for the animal, one is for human. You know, the human one is very difficult to buy, but the animal one maybe you can get it from some stores.
Yeah.
So maybe he's taking the animal one.
A lot in pet shop. I've seen ivermectin in pet shop as well.
Yeah, when people getting desperate, they just simply buy whatever online, you know, and then later on they are going to be sent to hospital, I think. So it's a very important message to all of you, not to simply take ivermectin.
Yeah, and in fact, to top up what Dr. mentioned, do not try anything without proper consultation by your doctor or your pharmacist, because we have to protect ourselves from our end, because otherwise when the damage is done, then it's very difficult to reverse it. So do our due diligence to preserve the safety of our body, the safety of our organs, the well-being of our body, by not simply taking anything per suggestion by your buddy or WhatsApp or Facebook message, or just because they showed their own little evidence, because you will need to find at least 20 more evidences to support the use of the medication.